Hey, what's up YouTube? My name is Chi and thank you again so much for checking out my channel. I am so happy to have you here and let's get into today's video. So as you can tell by the title, we are going to be talking about the truth of being a CNA, PCA, PCT, nurse aide, and nurse tech in the hospital. So I know a lot of you guys may be joining my channel, joining the family here because you guys are interested in becoming a CNA or a PCA and eventually going on to becoming a nurse. So that said, being a CNA or PCA is a wonderful starting point in order to get you on your journey and to really get you to realize, is this right for you? I 100% feel that everyone who decides to become a nurse should definitely start out as a PCA first. There is so much that you see, there's so much that you do that is so eye-opening into the profession of nursing. And don't get me wrong, there are stark differences between the two. Everything you do as a PCA is not exactly what you do as a nurse, but everything that a PCA can do is well within the scope of nursing. So that said, I think it's a wonderful opportunity. I would not change it for the world, but for people who are on their nursing journey, I do think that there is a lot there is a lot that you learn along the way that you might not have realized when you maybe signed up for your PCA class or just started on your nursing journey after you took the fundamentals of nursing. So again, in this video we're just going to be going over some of the top things that I learned in the last year and a half that I've been a PCA that I think would be really helpful. I wish somebody told me. I wish I saw a video like this when I was first becoming a PCA, and I hope this helps you guys on your journey. Again, maybe it'll help some of you guys reevaluate if nursing is right for you. But again, this is not meant to scare anyone. This is just meant to inform you. So again, I am so excited to be making this video, and let's get into it. So, number one, being a tech is literally back-breaking work. So, as a CNA or PCA, your entire job duty is essentially managing the ADLs of the patient. That includes toileting, bathing, turning, feeding, possibly ambulating, etc. That said, there are so many patients who are unable to stand on their own or move on their own. So that means that it is our job, along with the nurses and physical therapists, in order to move these patients to comfortable positions or to transfer them from bed to chair, chair to bed. Maybe they slid down on the bed and we gotta pull them back up, etc. You will realize very quickly that it requires a lot of strength to be a PCA. A lot of job ads and descriptions and open availabilities will say in their wanted ad that you need to have the ability to lift at least 50 pounds. And that is 100% true. The thing about being a PCA is that you typically work with a team of nurses and a team of other PCAs. To be honest, sometimes you're going to be on your own. That said, it's vital that you use proper body mechanics when you are transferring and moving patients, because it is so easy to throw something off. Like, trust me, I became a PCA when I was 24. I'm 25 now. So it's only been a year, and I can tell you and promise you that I have back pain now in only 1 year. So I can't imagine doing this for 10, 20, 30 years and not have this get any worse. You see what I'm saying? It's very crucial that you take care of yourself, you save your back because you only get one. To kind of go off that, in CNA, PCA school, they teach you all about the textbook proper way to lift and transfer patients using all the fancy equipment, slide boards, Hoyer lifts, etc. I'm going to be 100% real with you. In the hospital setting, depending where you might be, again, I can only speak from my own experience, but depending where you are and the acuity of your floor, sometimes a lot of that equipment, you don't have no idea where it is on your floor because no one's ever used it. Two, if it's an emergent situation, you might not have time to go and grab that piece of equipment that you might really need. The reality of it is, you're going to be swamped with work from the moment you get onto your unit. Again, every unit's different. I can't speak for everyone, but PCAs, our job, we are a very task-based job and profession. So that said, from the moment you get to your shift to the moment you leave your shift, there is a certain standard of tasks and things that you must complete, no questions asked, before you clock out for your shift. That said, in those 8 to 12 hours, no matter how long your shift is, depending, you're running, you're hustling, you're moving, you're running, and you're getting things done. Trust me, you're gonna have a million things going off at once. A call light here, somebody asking for ice and water, somebody in the bathroom, somebody getting up out of bed, somebody taking off all their clothes, somebody yelling, screaming, family members who are lost, family members who are concerned, people who want their meds, the nurse needs to go get blood, there's a code going on, and you need to get the crash cart. There will be a million things going on at once. So you need to prioritize. Let me say that again. Prioritize. I want y'all to listen to that, play that back, and really let that stick. Prioritization is key. And if you do not learn to prioritize early on, girl, I don't even know. It's a wrap. It's a wrap. Like, just being real, like, you need to understand in the moment when you have 10 things being asked of you, what is most important? What do I need to do now, and what can wait? If you have a patient that's gotten up out of bed, bed alarm's going off, they got up when you told them not to, they're high fall risk, they're in the bathroom, and then somebody over here who is unfortunately incontinent, and they're playing in their poop and everything's everywhere, the family's asking you to clean them up right now, you're gonna have situations like that, and you have to understand what is more pressing. Teamwork will make or break your shift. Something that's really important when you're choosing a facility to work at and really just getting a feel of the unit is the teamwork and the culture of that floor that you're going to be working on. Some facilities, when you're on the floor, you will be working with at least one other tech. So you guys either split the floor, do the floor together, and you guys kind of just figure out what dynamic works for you. But there will be times when you are short-staffed, people call out, you are left by yourself because there was no one to cover that empty position that they needed for the night. Or you might be on a floor that, again, it's just a heavy floor. There's only one tech they have for that entire floor. You might have upwards of 35 patients? Yeah. That said, teamwork is crucial to getting through your shifts, making sure you're able to give the proper and highest quality care possible to your patients, and really just staying sane, to be honest. Depending on the floor, depending on the culture of that floor, you will either have a lot of nurses who completely understand that when you are by yourself or when you guys are short-staffed and there's not enough of you guys to do your job, they will be so willing to jump in, really just help you with whatever you need to get done for that day. And in my experience, you will also have a lot of nurses who don't see a tech's job as anything to do with their job description and will leave you to the wind, leave you drowning in work, and they wouldn't bat an eye. Again, not to say that they're not busy, but let's be real. You will have people who are having a whole full-blown conversation about what they did last night with who. Meanwhile, 10 call bells are going off. You're still changing a patient, but they'll come to you, right? They'll come to you asking, hey, patient in 432, they're wet, they need to get changed. They've been calling about going to the bathroom and no one's come in and now they soil themselves. Can you please get to them? Like, they're calling. you see me changing this patient, right? You see I haven't sat down since I've gotten here, right? You see I've been doing vitals, answering call bells, changing patients, ambulating patients. You see I've been doing all that, right, since I've gotten here. I haven't had a break, I haven't peed. Meanwhile, you had your whole lunch talking about what you did at Florida last week. You've been chilling at the nurse's station on your phone, and you're asking me to go and change a patient who unfortunately was not attended to quick enough, so that therefore they soiled themselves. Now you're telling me to go and change that patient with. Sis, that's a very harsh reality. You will have people who see you drowning in work. They will let you know, come and do this. And they will lend absolutely no hand, regardless of the fact that it might be their patient. And that is something that's definitely a pet peeve, but that's definitely something that you have to be aware of. You have to know when to speak up and speak out. You have to know when to verbalize, hey, are you free? Oh, okay, can you please come help me with this patient, please? And you have to be firm in that. Don't let anyone come and bully you into thinking you have to do everything on your own. Granted, you have to understand that you need to have a certain level of autonomy in order to complete certain tasks by yourself. You shouldn't have someone necessarily to hold your hand all night, every day. But there comes a time when you clearly need that second person just to, again, save your back, save yourself, work as a team to get things done efficiently. And people need to understand that, again, it's not you, those are your patients and those are my patients. We're on this team, we're on this floor together. The whole floor is our responsibility at the end of the day. If you need help to take care of that patient, okay, I'm in. If I need help, I need you here right with me. So that's exactly how it needs to be. And again, don't feel afraid to step up, because going back to that point, teamwork is crucial. And if people are not going to be willing and giving of that upfront, you need to know when to respect your own job, respect yourself, and be able to advocate for all these patients to do the job safely enough so that you're not hurt, they're not hurt, and everyone's attended to in a timely fashion. The third truth of being a tech/CNA, there are going to be both nurses and patients that think you are their personal aide. You have to understand that as a tech, you are shared. You are a being that is shared amongst all of the nurses and patients that you are caring for. That is, you are a vehicle, you are a tool of good and caring and help that needs to be split amongst maybe 5 nurses, 4 nurses, 6 nurses, what have you. If there is a particular nurse or patient that is constantly requiring you to be somewhere where it's becoming detrimental and you're no longer able to give sufficient time to your other patients, you have to let the nurse know, or you have to let that patient know, hey, okay, I can do this for you, I have no problem doing this for you, but I have X amount of other patients and I have to be there for them as well. I have other patients I must attend to. Please, if there's anything you need, please let me know. That way I can attend to everything while I'm here. Okay? That way you're not coming back in every 5 minutes to the point that you're neglecting all your other patients, because again, everybody deserves your time, attention, and care. And everybody's entitled to quality care from you. I think this is 4, but the reality is you're going to come across some people, patients, co-workers, and otherwise who no matter what you do, you just can't please them. Like, I know I heard when I was little, there was definitely a quote from somewhere, I'm gonna find it, but it was essentially saying, you can be the juiciest, sweetest peach in the whole wide world, but guess what? There's always gonna be somebody who don't like peaches. And to be honest, the same is true. You can be the nicest, most helpful, most giving person, but you can't control what people come into the hospital with, whether it's a coworker or again, a patient. you don't know what's going on in their lives. Sometimes it might be something super stressful. From a patient's perspective, they're in the hospital. This is probably the worst day of their life. They don't want to be there. They want to be home. Everything is new and complicated and confusing and unfamiliar. And people just have bad days. That said, don't beat yourself up when you give and give and give so much of yourself, but it's not pleasantly accepted or welcomed. Like, I've had a patient who I was trying to just, help straighten things out, pick something up that, fell on the floor, because I saw the strain it was putting on them with all the back pain that they had. And the first thing I received was, leave me alone. I'm not an invalid. Leave me alone. I don't need your help. And I was taken aback, because I didn't mean to offend anybody by offering them help as if they couldn't do it for themselves. I was just trying to be helpful. But again, you have to understand that there are people who have had so much autonomy, or who have just so much self-pride in themselves, and this is something so new to them, and just the act of helping sometimes just reminds them of what they are, where they are, and it's painful, it's hurtful. So don't take that to heart when it comes from a patient. Again, I've had patients who have snapped at me. A couple hours later, they had some food in them. The doctor came in, and they're a whole completely different person, and they've apologized. I'm so sorry for acting this way. And to be honest, I've had patients who've snapped at me, went on their merry way, and never apologized, but that's okay too. Because you have to understand, we're going into the hospital because this is a choice. We made the choice to work there. We made the choice to be of service and to help others. The patients in the hospital, they don't want to be there. They didn't choose to be there. So it's a human thing. You have to understand that that's just the gamut of emotions that people go through. And you know what? It's okay. It's not you. It's not you. Don't beat yourself up. All right, so number 5. You can't be squeamish about body fluids, secretions, excretions, sounds, gases, sights. As a CNA, you will see everything, and it behooves you to, again, figure out what you need to do to get through your day, and without explicitly showing your discomfort at the sight of these things. Because as a patient, trust me, they're embarrassed too. They don't want to be there, having bowel movements on themselves and not being able to clean themselves up, or wetting themselves and not being able to, they don't want to be there either. They're just as embarrassed. So you really need to rein it in and figure out what is it that you can't do. Is it vomit? Is it pee? Is it poo? Is it just smells? Is it certain, maybe blood? What is it that you have a hard time just being comfortable with? Once you identify that, see what you can do to kind of make it a little bit easier for yourself. Like, for example, me, smells, it's a wrap. I don't mind seeing poo. Smelling it is a whole different story. Can't do it. It's not easy for me, and okay, that's okay. So what do? Just a little trick. You get a mask, get some Vicks or toothpaste, whatever. Put a little bit on that inside. Put that up to your nose. Put your mask on. Fit it to your face, and boom, you're out here smelling minty fresh and just fields of flowers, and you're able to get through your job. And the patient has no idea, because again, you don't want to be in that room cleaning them with just look on your face of. You just got to be real cognizant of your facial expressions and how that might make a patient feel. So that said, do whatever it is that you need to do to just be okay with it. Again, if it is something that over time you're still not able to get over, I would definitely reconsider being a PCA, because again, that's our entire job. ADLs, blood work, cleaning up bodily fluids and substances, and just obtaining specimens, like that's literally our whole job. So it's definitely going to make it a lot easier if you're not so squeamish about those types of things. I hope all of that really helped you guys. If you're deciding to be a PCA, if you want to be a nurse and you're thinking about being a PCA beforehand, I, again, have absolutely zero regrets about becoming a PCA before I start my nursing journey, because there's so much that I've seen, that I've learned, that I've experienced that I would not have gotten, that I personally believe if I had just gone straight to nursing school and was just thrown straight into a hospital. Because, not gonna lie, it was hard for me in the beginning. I think I cried at the end of my orientation because I felt I just wasn't getting it. Like it was hard. But looking back on that a year and a half later, I've just become so much of a stronger person. I've become so humbled. I've become so much of a better person. Just seeing everyone that I've been able to care for, just seeing people progress positively. And again, just being humbled and understanding how precious life is when, things don't go as well as planned. And, you have patients that expire. So you see everything. You see so much. You learn so much. I've met so many amazing nurses who have taught me, who have educated me, who have allowed me to see things, help them do things. And again, it's only reinforced my desire and passion to want to become a nurse. So again, I hope you guys have enjoyed this video. I hope I've shed some light on some things that you might want to think about if you're thinking of becoming a PCA. So please leave it down in the description below. If you're currently a PCA, what is it about your job that you wish you knew before you became a PCA? Because trust me, honey, I can make a part 2, a part 3, a part 4, a part 20 to this video. And that doesn't take away from the fact that I love being a PCA, but again, no one gives you a manual, what to expect before you get into some of these professions, especially in healthcare. So again, leave that down below. Let me know, are you guys, in nursing school? Are you applying? Are you doing your prereqs? Are you thinking about becoming a nurse? Are you a PCA? How has this changed your mind about nursing, or how has it just reinforced your passion to want to be a nurse? So again, leave that all in the description below. If you like this video and you would like to see more content like this, please give this video a like and a thumbs up. I would so appreciate it. Thank you again so much for taking the time for watching this video. Please leave a comment down below, as we said before, and please consider subscribing if you'd like to see more content like this.